Have you already tried taking care of yourself, and your knee still got worse? Maybe you started walking more, joined a gym, went back to swimming. You did everything you were told to do, and even so, by the end of the day, your knee was more swollen, stiffer, and more painful than before. And you were left wondering what was going wrong. After all, you were moving, putting in the effort, doing your part. The problem is that not every exercise is the same for someone with knee osteoarthritis. Some movements, even the most recommended ones, even those that seem completely harmless, may be increasing the pressure inside the joint without you realizing it. And when that happens over weeks or months, inflammation builds up and the pain gets worse. But here is what I need you to understand before we go any further. The problem is rarely the activity itself. It is how it is being done. And that changes everything, because it means that in most cases, you do not need to stop exercising. You need to understand what to adjust. I am a physical therapist with over 10 years of clinical experience, and in this video, I am going to show you 7 activities that can worsen knee osteoarthritis after 60, and what to do differently in each one so you can keep moving safely. And stay until the end, because as a bonus, I will show you 2 simple exercises you can do at home to start protecting your knee. No gym, no equipment needed. Before we get into the list, I need to explain something, because without this, the next activities will seem random. There is a muscle imbalance behind almost every case of chronic knee pain after 60. On one side, we have the quadriceps, the muscle at the front of the thigh, which most people overuse. On the other, we have the glutes, the hip muscles, which most people underuse completely. When the quadriceps works more than it should, it pulls the kneecap downward and compresses the knee joint. This pressure, accumulated over time, leads to inflammation, wear, and pain. And here is the problem with many of the exercises recommended for the knee. They strengthen the quadriceps even more, without balancing it with the glutes. The result is that the person exercises feels like they are doing the right thing, but the pressure inside the knee keeps increasing. This does not mean you are doomed to feel pain forever. It means your body needs to learn how to distribute this load better. And when that happens, a lot changes. As a physical therapist, what I see in the clinic every day is exactly this. People who were doing everything right, in theory, but were feeding this imbalance without realizing it. This video exists to change that. Tell me in the comments, have you ever tried exercising to improve your knee and felt it got worse? I want to know what happened. So let's start with the activities that worsen arthritis. 7. Running. This is the most obvious one, and also the most misunderstood. Running has a terrible reputation when it comes to knee osteoarthritis, and not without reason. Each stride places a load of 2 to 3 times your body weight on the joint. For a knee that is already inflamed and overloaded, that can be too much. But here is what few people talk about. The problem with running for those with osteoarthritis is rarely the impact itself. It is the muscle imbalance I just explained. When you run using more quadriceps than glutes, which is far more common than it seems, each step increases the pressure inside the knee. And that is when running becomes harmful. If you are in a phase of intense pain with an inflamed knee, running is not for now. Not because it will destroy your knee forever, but because your knee needs a strength foundation before it can handle that impact safely. What to do instead? Light walking on flat ground with proper cushioned shoes and strengthening exercises. Exactly what we will cover in the bonus. When your glutes are stronger and the pain is under control, running can gradually return. With the right muscles doing the work, it stops being the enemy and becomes an ally again. Now let's move on to number 6. This one surprises a lot of people because it seems like a safer alternative to running. But there is a trap that few notice. 6. Elliptical. The elliptical is exactly the kind of exercise that seems perfect for people with knee pain. No impact, smooth movement, easy to control intensity. That is why doctors and physical therapists recommend it so often, and why so many people get confused when they finish a workout with more knee pain than before. The trap of the elliptical is the same as running, just harder to notice. Because the movement is so fluid, so comfortable, you do not realize you are using your quadriceps more than your glutes. And when that happens, the pressure inside the knee increases with every stride, silently, until your knee lets you know it has reached its limit. The test is simple. When you finish a session on the elliptical, what feels more tired, the front of your thigh or your glutes? If the answer is the front of your thigh, the elliptical is feeding the imbalance. What can you adjust? Think about pushing the pedal downward by contracting your glutes, not by pushing with the front of your thigh. Lean your torso slightly forward, reduce the speed and focus on the quality of the movement before thinking about intensity. If your glutes start getting more tired than your quadriceps, you are on the right track. Give it a try and come back to tell me how it went. Now let's move on to number 5, and this one might surprise you. It is an activity everyone associates with lightness and joint relief. But there is a detail that few people notice. 5. Swimming. Swimming is almost unanimous when it comes to exercise for people with knee pain. The water reduces impact, relieves body weight, and allows movements that would be impossible on land. And all of that is true. Swimming can be excellent for the knee. The problem lies in how most people swim. When you swim freestyle, the most common style, where the arms alternate and the legs kick behind, the natural kicking motion tends to activate the quadriceps more than the glutes. You extend your knee forcefully with every kick, repeatedly, across the entire length of the pool. Multiply that by hundreds of repetitions in each session, and the result is the same as always. Overworked quadriceps, underused glutes, and increasing pressure on the knee. What to adjust? Instead of focusing on kicking downward by forcefully extending the knee, think about kicking upward by contracting your glutes. The movement becomes less aggressive, less explosive, but much healthier for the joint. Another great option in the water is walking in a shallow pool or doing water aerobics, which keeps you moving without impact and allows you to use your leg muscles in a much more natural way. The water is still your ally. You just need to know how to use it. Now let's move on to number 4. Another exercise that has a reputation for being gentle on the knee, but hides the same trap. 4. Cycling. Cycling is one of the most recommended activities for people with knee osteoarthritis, and for good reason. No impact, smooth circular motion, great for cardiovascular conditioning. But there is one detail most people completely ignore, and it turns the bike from an ally into a villain. The problem here is not the movement itself, it is the seat height. When the seat is too low, the knee bends excessively with each pedal stroke. And when the knee repeatedly goes beyond 90 degrees of flexion, the pressure inside the joint increases significantly, especially on the kneecap cartilage, which is exactly the area most affected by osteoarthritis. You pedal for 30 or 40 minutes in this position, and your knee silently accumulates this overload without giving any immediate warning. The warning comes later, in the swelling, the stiffness, the pain that shows up hours afterward. What to adjust? Raise the seat until your knee has a slight bend at the lowest point of the pedal stroke. Never completely straight, but far from overly bent. This small change drastically reduces pressure on the joint. If you are using a stationary bike, it is even better for the knee, and the same principle applies. Adjust the height before you start, and pay attention to how your knee responds during and after the workout. The bike is still an excellent option. It just needs the right setup. Now let's move on to number 3. This is a very common exercise at the gym, and the mistake people make with it is almost always the same. 3. Leg press. The leg press is one of the most widely used machines in gyms, and one of the most misused by people with knee osteoarthritis. The machine feels safe because you are seated, supported, not carrying your body weight. And in fact, when done correctly, the leg press can be a valuable exercise. The problem is the range of motion. When you lower the platform too far, bringing your knees close to your chest, the joint goes into a deep flexion that the cartilage simply does not tolerate well. The pressure inside the knee in that position is enormous. And what happens in practice is that people go as low as they can, Thinking more range means better results. It means more pain. There is also a second very common mistake: letting the knees collapse inward during the movement. When that happens, the kneecap alignment is lost, and the pressure concentrates on a specific point in the cartilage, exactly where osteoarthritis is already present. What to adjust? Work with a reduced range of motion. Lower only until your knees form a 90-degree angle, no further. Keep your knees aligned with your feet throughout the movement, neither inward nor outward. And use a load that allows full control. It is not about how much weight you push, it is about how your knee behaves during the exercise. Now let's move on to number 2. This is a movement you probably do every day without even noticing, and when done incorrectly, it takes a heavy toll on your knee. 2. Incorrect squat. The squat itself is not the problem. It is one of the most natural movements of the human body. You squat to pick something up from the floor, to sit down, to get up from a chair. The problem is when this movement is done with 2 very common mistakes that most people do not even realize they are making. The first is letting the knee travel far beyond the line of the foot. When that happens, the force angle on the kneecap changes completely. The patellar tendon, which connects the kneecap to the tibia, is placed under excessive tension, and the cartilage starts receiving pressure it should not be receiving. For someone who already has osteoarthritis, this is like pressing an inflammation button over and over again. The second mistake is even more harmful: letting the knee collapse inward during the movement, what physical therapists call knee valgus. You know when you squat and your knees move toward each other, almost touching? That is exactly it. When the knee collapses inward, it completely loses its natural alignment, and the pressure becomes unevenly distributed across the cartilage, accelerating wear and increasing inflammation. What to adjust? Think about sitting back, as if there were a chair behind you. Your torso leans slightly forward, your hips move back, and your knees stay aligned with your feet, pointing in the same direction as your toes. If you notice your knees collapsing inward, reduce the depth until you regain control. Less depth with proper alignment is far more valuable than going deep and losing control of the movement. Now let's move on to number 1. And this one will surprise you because it is something almost everyone does thinking it is helping. And the body responds in a completely different way than you expect. 1. Aggressive stretching. We have reached number 1, and this is the one that surprises people the most, because stretching has the image of something gentle, therapeutic, harmless. No one imagines that stretching can make osteoarthritis worse. But when it is done aggressively, that is exactly what happens. Let me explain the mechanism. Inside your muscles and tendons, there are small sensory cells whose job is to protect the body from injury. When you force a stretch beyond the limit, that intense pulling sensation that hurts a little but you keep going because you think it is helping, these cells send an alarm signal to the nervous system. And what does the nervous system do? It contracts the muscle to protect it from injury. In other words, you are trying to stretch, but your body is contracting. The muscle becomes more tense than before, and excessive muscle tension around the knee increases compression inside the joint. There is also a second problem specific to the knee. Stretches that bend the joint too much, like forcefully pulling your heel toward your glutes, directly compress the cartilage. For a knee with osteoarthritis, this compression can trigger inflammation that lasts for days. What to adjust? Gentle stretching, never forced. On a scale from 0 to 10, stay between 1 and 3. A light, comfortable tension, never discomfort. Hold for 30 seconds, breathing calmly without trying to go deeper. The goal is to relax the muscle, not fight against it. Stretching is important, but the body responds much better to gentleness than to force. Tell me in the comments, which activity were you doing the wrong way, and which one are you going to adjust to protect your knee? Throughout the video, I talked about the imbalance between the quadriceps and the glutes, and how it is behind almost everything that worsens knee osteoarthritis. So it makes perfect sense to finish with 2 simple exercises, no gym, no equipment, that start correcting exactly this imbalance, and you can begin today. Glute bridge. Lie on your back on a mat on the floor, or even on your bed. Knees bent, feet flat at hip width, arms relaxed by your sides. Before lifting, squeeze your glutes. Do not lift first and squeeze later. Squeeze first and let your hips rise as a result of that contraction. Lift until your body forms a straight line from your knees to your shoulders. Hold for 2 seconds while feeling your glutes engage, and slowly lower down, one vertebra at a time. If you feel the effort in your lower back or the front of your thighs, stop and bring your feet a little closer to your body. 2 sets of 12 repetitions. When it becomes easy, progress to 3 sets of 15. Standing hip abduction. Stand next to a wall or a chair for support. Keep your spine upright and your gaze forward. Now slowly move one leg out to the side. It does not need to go high, about 30 centimeters is enough. Hold for 1 second at the top, feeling the side of your hip working, and bring the leg back with control. Do not let your hips tilt. Your torso stays stable the entire time. 2 sets of 15 repetitions on each side. When it becomes comfortable, add a resistance band just above your knees to increase the challenge. These 2 exercises together will not fix everything at once, but they are the right starting point. They are the direct antidote to the imbalance we discussed today. What we covered today was designed for people with knee osteoarthritis in a stable phase, with pain present but under control. If your knee is very inflamed, with visible swelling, intense pain that keeps getting worse, or a feeling of locking or instability, consult a doctor or physical therapist before doing any exercise. Some situations require an individual assessment before starting any movement. And if you recognized any of these 7 activities in your routine, do not panic. The goal of this video was never to make you stop exercising. It was to help you exercise better. Small adjustments in form, range of motion, seat height, and awareness of which muscle is working. These simple changes make a huge difference in the long run. Tell me in the comments, which of these 7 activities surprised you the most? I want to know what you did not expect to find on this list. I left 2 options in the pinned comment that can help you on this journey. The first is a complete exercise program, organized step by step, for you to follow at home at your own pace. The second is a natural supplement developed specifically for joint health and to help reduce inflammation. The links are there. And if you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel. See you in the next video. And until then, keep moving.